Hi, welcome. This is Therapy Unit 5, recorded in 2024. Let's get started. Okay, so before we get into therapy, I want to talk to you about a few careers. Now, these are not on the AP exam, but real quick, psychiatrist, if you go to a psychiatrist, you are going because you want to be treated with medication. Okay, you may still get the talk therapy, but what'll happen is you'll see your psychiatrist for about 15 minutes, and then you'll spend an hour talking to a therapist that works with the psychiatrist. Psychiatrists make too much money to sit there and talk to you about all your problems. They go to medical school and they make more money. Okay, now a psychologist, they get their PhD and they do their residency and all that stuff. Clinical psychologists are good for uh, talk therapy. They do other things too, other than talk therapy, but they do not give medicine. Okay, you may get a prescription from your doctor and then see a psychologist also. Okay, all right, and then a counselor. They don't treat mental illness, but they do deal with mental illness. I know that's kind of weird, but if you want to just talk to somebody, you want marriage counseling or grief counseling, life strategies, go see a counselor. You can still talk about depression and anxiety and stuff like that, but um, and they will use some of the same techniques that a psychologist uses, but it's not the same. It might be if you have a particularly talented counselor. All right, moving right along. Okay, now this is important. So write this down. This is not a therapist, but I put this here because I wanted to talk about all the careers in one place. An industrial organizational psychologist works in human resources. They work for large corporations. And what they do is they do a lot of surveys. They they do a lot of management training. Like for example, is it better to be a mean manager where you're really strict and you fire people, or is it better to be an easygoing pushover manager? Either way, both can be bad, okay? But my point is that management styles is one of the things they talk about. Employee morale. Why do you want your employees to be happy? Because if they're not happy, they will quit, and then you're spending a lot of your resources training new people. Here's another thing that IO psychologists talk about. Should you make them come work in the office, or can you let them work remotely? That's a big debate going on right now. If you let them work remotely, they may not get as much work done. But if you make them come to the office, then you have to spend more on rent. So that's an issue. So they focus on teamwork, employee morale, management styles. Okay. All right, let's do it. Oh, and by the way, forensic psychologists, they spend a lot of time in jails interviewing people. They they testify in court a lot. We already talked about that, so I want to get moving. Okay. All right, try this question. The answer is B, an industrial organizational psychologist. Let's do a couple more. All right, do this one. The answer is industrial organizational. Okay. Now, here's an interesting one. It's not the easiest. An industrial organizational psychologist would be most likely to study the what? The answer is management training or management styles, things like that. Okay. Okay. Moving right along to therapy. Okay. So you've got some of this stuff is going to sound familiar. Like, for example, I taught you the psychodynamic perspective when I taught personality, Behavioral, I taught that in the learning chapter. So some of this is going to sound familiar. All right, so you need to know what causes mental illness as far as each perspective is concerned. For the psychoanalytic perspective, what causes mental illness? Something in the unconscious mind, something repressed, like a repressed sexual desire or repressed jealousy. You may be unconsciously angry at your sister and you may not be aware of it. So that might be why you're mad at her all the time. That's what someone in the psychoanalytic perspective would say. Okay. All right. This is important. Write this down. Okay. So, first of all, psychoanalysts, what they do is the patient always lays down on the couch. That's something that they always do, and they don't even face their therapist. This is old school. They did this a lot during the 30s, 40s, 50s. They still do it some in the world. I heard that in Argentina they still do a lot of psychoanalysis, but this is pretty outdated stuff. One thing that the psychoanalysts did was they analyzed your dreams. So you would lay down on the couch and then you would talk about your dreams. The psychoanalyst would interpret that dream. That there is no scientific basis for that. We don't do that anymore. Free association. Lay down on the couch. Your therapist says, just talk about whatever pops in your mind. And then you start talking. You'll talk for an hour. And your therapist will sit there, not say anything, take notes, and analyze what you said. That's called free association. You freely talk about whatever you want, and the therapist analyzes it. Both of these techniques are about gaining access to your unconscious mind. It's about getting into your unconscious. Hypnosis used to be a psychoanalytic method, but it's on the list of stuff you need to know. But it's good for pain relief and anxiety, but hypnosis is not good for what psychoanalysts used to use it for, which is to get into your unconscious mind and get out memories that you have repressed. That is not what it's good for. There's no scientific basis for that. But it is undeniably good for pain relief and anxiety. But we don't, as scientists, we don't really know why. All right. So there you go. Dream analysis and free association are psychoanalytic methods. Hypnosis, know what it is, but I wouldn't associate it in modern day with psychoanalysis. So, in summary, what causes mental disorders? Something in the unconscious mind, unconscious anger, unconscious sexual desires. How do you treat? By getting into the unconscious mind, free association, dream analysis, by doing what's called psychoanalysis. Okay? All right, let's try some questions. All right, do this one. What is the bases for the development of mental illness? Bases is plural for basis. The answer is it's always something in the unconscious. Always. All right. Using techniques such as free association to explore a client's early relationships is characteristic of what type of treatment? The answer is psychodynamic or psychoanalytic. They both mean the same thing. All right, moving right along. Behavioral therapy. I taught you a lot of this stuff in the learning chapter. Behavioral therapy is modern, it does work. And so everything I'm about to teach you is real. It's not theoretical and it's not historical. So, what causes mental illness? Conditioning, classical conditioning, operant conditioning, even observational learning. For example, if your best friend is anorexic, you may pick up on that by observing it. How do you treat it? By changing the behavior through conditioning. I'll be more specific, but this is just a summary. All right, write this down. So, if you want to treat a phobia or treat for obsessive compulsive disorder, you may use systematic desensitization, where you gradually expose the person to what is giving them anxiety. So if you're afraid of spiders, you may start with a picture of a spider. And then you learn breathing techniques, you learn relaxation techniques, and then you gradually and systematically go up to a toy spider and then to a spider in the next room, and then a spider in a cage in the room. Eventually, the spider will be the non venomous spider, would be crawling up your arm. Now, if you have a fear of spiders, you got to imagine a spider crawling up your arm is pretty impressive. But you do it systematically, you desensitize the person. Now, I'll show you a video for that, but before that, I want you to think of aversion therapy. Aversion therapy is when you use classical conditioning, basically counter conditioning. I'm sorry. You're basically using classical conditioning to get yourself to stop a behavior. All right. I mentioned earlier about alcoholics take a pill to get nauseous, so it makes them not want to drink. It doesn't work for everybody, but for some people it does. All right. So systematic desensitization is when you desensitize yourself to an anxiety or a phobia. All right. So let me show you a couple of videos.
It's now time for Marvin's exposure, and I'm really worried about the next level for him.
So, as you can see, we are here in the beautiful Golden Gate Dog Park. You don't go to parks, do you? Why not?
No.
Why?
They're dog friendly.
Well, that
Beaches,
sounds like
parks.
a good thing.
To you, not to me.
Okay.
This exposure is going to bring up a lot of pain and memories from the past.
Oh, hell no.
Hey,
Oh,
hey,
no.
hey, Marvin, stay with me.
This pit bull puppy comes on a corner. My heart, like, almost jumped out of my body.
Stay with me. Stay with me. You're okay. You're okay. Stay with me. Let's do this together. You're good. You're in control. If you're backing up, you're running from your fear. We'll let the dog get closer to you, but I don't want you to back up. This dog represents 40 years of being in pain. So can I let the dog come closer?
A little bit.
Okay. Okay, you tell her when
So
to
it's
stop.
gradually
You'll
and
let her know.
systematic.
Okay. All right. Good, good, good. You're good. Do not look away from the dog, okay? Go ahead and come a little bit closer. You're all right. Okay, think of your
Panic
family
attack.
who is not going to want you to suffer. I think you should pet the dog.
This is systematic
No, look at that baby.
desensitization.
Oh.
Marvin, come on, Marvin.
Ooh.
Think of your girls. Think of your girls. Think of your girls.
I ran a coward.
You're not a coward. You are not a coward. You are a strong person. You're not a coward, Marvin.
I close my eyes and I go back in time, like where I was when I was 5 years old.
This is why you're confronting your fear, because you can't keep living like this. Okay? You can't keep living in sheer terror. Enough is enough.
Babies.
I know.
Can't love my babies
I know.
so much.
You cannot leave being afraid still. I know you're gonna be scared, but you have to touch the dog before you leave. I'm sorry. Walk up to the dog. Let's see you shaking.
Oh my God.
Look at you.
Dogs know fear, they go after fear.
I know it was tough, but you're moving forward and you're regaining your life.
So he started off at a distance, and then he gradually, with the help of a psychologist, got closer and closer and closer to the dog. We call that systematic desensitization. Now, aversion therapy, a good example would be the alcohol and the pill. Here's a funny example.
Come on, only one pack left.
I think I'm gonna barf.
That's what I wanted to hear. Good job, son. When you're finished, you want to get that with a hose?
Okay, so aversion therapy is a technique. Aversion therapy is a technique where you want to stop a behavior. In the cartoon's case, stopping the smoking behavior. Okay, now this is important. Operant conditioning, the use of rewards, you have what's called token economy. I should have made that red, but it's a point system. You may have this at your school, or you may have had it when you were younger, but if you do what you're supposed to do, you get points, you get tokens. And then you can use those tokens for free ice cream or privileges or something else. They do this in mental hospitals. That's one reason I want you to see the movie To the Bone. They talk about the point system. And if you show up to group therapy, you get up on time, you get points. If this is an eating disorder clinic and you eat food, you get points. Okay, you get points for everything that you do that you're supposed to do. Okay. So when you do it in an elementary school, it's not exactly therapeutic, but it's the same concept. It's a behavior modification tool. And by the way, I want to remind you, I want to make sure I got this. These are behavioral techniques. These are behavioral techniques, not psychoanalytic. These are behavioral techniques. Token economy is a behavioral technique. Aversion therapy is a behavioral technique from the behaviorism perspective of psychology. Okay? All right. So, do this question. So, Tom, I don't love this example, but he's using a verse of. Never mind. All right. The answer is aversion therapy. Aversion therapy. He's trying to stop himself from a behavior through association. Okay? All right, let's do another one. Systematic desensitization is most likely to be used in the treatment of what? The answer is phobias. It's also used with obsessive compulsive disorder, like touch the germs, touch the germs. All right, do that one. The answer is token economy. Stars, tokens, same thing. All right, I screwed that one up. So Jim is using aversion therapy. So aversion therapy is a behavioral technique. Don't worry, I got plenty more. All right, do this one. All right, so it's a phobia of public speaking. So the best way to get rid of a phobia is, the answer is systematic desensitization. Imagine getting VR goggles on and seeing yourself speaking in public. You could use that to desensitize yourself. All right, do this one. The answer is aversion therapy. Moving right along. Okay, do this one. Which one of these is behavioral? The answer is D. Okay. A is cognitive therapy. I haven't taught you that. C is psychoanalytic. Anyway, moving right along. So, in summary, what causes mental disorders? Our conditioning, our classical conditioning, operant conditioning. How do you treat it? Change the environment, condition yourself to get better. Systematic desensitization, token economy, aversion therapy. All right, moving right along to another perspective, the humanist perspective. In the 60s, the humanists come along and they say psychoanalysis is garbage. We need to throw out the couch. Throw out the couch. And we need to start treating people like human beings. Oh, and also humans are not pigeons in a cage. We're humans. And we need to start treating people like humans. So the word humanism. Okay. I don't think names are that important anymore, but it's focusing on the human potential. It focuses on free will. You have the ability to be whatever you want to. That's humanism. All right, there's a few words you need to know for humanistic therapy. It's also called person-centered therapy. What does that mean? It means when you sit down, your therapist is going to say, so what do you want to talk about today? You are in charge of the therapy session, not the therapist. With psychoanalysis, it was, I went to medical school, you're just a dumb patient, you don't know anything. But with humanistic therapy, it's the therapist is there to help guide you to the answer. Active listening. Active listening, instead of the therapist just sitting there with a notepad taking notes while you talk for an hour, free association, the therapist will engage you more. The therapist will ask you to clarify what you said. They'll say things like, so what I hear you saying is, and you should do that too. Anytime somebody is mad at you, like let's say your mom is yelling at you for just everything. You try this and it may make things worse, but say, Mom, so what I hear you saying is blah, 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 blah. I mean, I can't guarantee you it'll work, but at least they might feel heard if you do that. So, Mom, what I hear you saying is you just want us to take more responsibility and to do things without being asked, to just do it. Unconditional positive regard. Think of the word unconditional love, but replace love with something more professional. You don't love your clients, but you might have unconditional positive regard, meaning that you're not too judgmental. Yes, I know that you've done some bad things, but deep down, you are a good person. You can't be judgmental toward your clients, to your patients. And then finally, empathy. Don't just sit there and listen to your client go on and on and on. Have some empathy. Feel what they are feeling. Say things like, wow, you really are going through a lot. Naturally, some therapists are more empathetic than others. But these four things are the basis for humanistic therapy, for person-centered therapy. Okay? All right. Another concept in humanism that I want to talk to you about is I want you to stop and I want you to think about, who do you want to be? Who do you want to be? I want you to think, let's say 5 years from now. Or no, how about not even 5 years from now? Who do you want to be right now? That is your ideal self. But Come back to reality, look in the mirror, and that is who you are. That is your real self. Now, think of this as a Venn diagram. If your real self does not match your ideal self, then obviously that is not good. You don't need to write this down, but some might call that neurosis, when your real self doesn't match your ideal self. Now, if your real self is very far apart from your ideal self, then that's obviously very bad. You might call that the shattered self. You do not need to write that down. Okay? However, if your real self almost totally matches your ideal self, we call that congruence. We call that being a fully functioning individual. I don't think you need to know those terms, but I do think you need to know the concept of your real self and your ideal self. If they don't match, that's not good. A humanist psychologist will help you to get these two to match. That's what humanism is about, maximizing your potential, letting your real self match your ideal self. Okay. All right, do this question. So the answer is unconditional positive regard. So basically unconditional love, but something more professional. I don't like the idea of parents giving unconditional positive regard. They give unconditional love. They might give conditional love. I will only love you if you make good grades. That would be conditional love. Okay. All right, here's another one. The answer is a mismatch between his ideal self and his real self. Okay. All right, do this one. The answer is unconditional positive regard. Okay. All right, moving right along. Tanisha's therapist often rephrases things that Tanisha has said and asks for clarification. So what I hear you saying is what? We call that, and I didn't teach this, but I did mention it, active listening. Don't just sit there and take notes. Talk to the patient. Ask for clarification. All right, take a look at this. This is a good visual. Okay, moving right along. All right, draw this on your notes. There was a guy named Abraham Maslow who came along and he said that we need to reach our low level needs first, our base level food, water, security needs, our base level needs, before we get to our higher level needs. Love and belonging, for example. He said that some people sometimes reach self-actualization, maximizing their potential, being all they can be. This sounds just like what I taught you earlier about having your real self match your ideal self. Yeah, they sound the same. It's all about maximizing your potential, being all that you can be. But that's humanist psychology, is getting rid of barriers to being all that you can be, barriers to self-actualization. So imagine going to a therapist and your therapist says, I want you to take a moment and I want you to make a list of goals. 2 years from now, what do you want to be? What is your ideal self 2 years from now? And then you do that. You make some goals, and then your therapist says, okay, what is keeping you from doing that? What are your barriers to self-actualization? And I think it's a good question. What is keeping you from achieving your goals? And that's what humanist psychologists do. Okay? Now remember, Maslow said you have to get your base level needs first before you can take on your higher level needs. If I were to go to these people and talk about their self-esteem when they don't know where their next meal is coming from, that would be ridiculous, right? Imagine me going up to a homeless person who doesn't know where they are going to sleep, and I talk about their self-esteem. It doesn't make any sense. You got to get your base level needs before you can move on to your higher level needs. Okay? One more thing on Maslow and his hierarchy of needs. Advertisements always hit on one of the Maslow's levels. At the top, you've got self-actualization, be all that you can be. At the bottom, you've got food and medicine. In the middle, you've got love and belongingness, fitting in. You're one of us. All right, moving right along. Okay. So, what causes mental illness? Barriers to self actualization, barriers to congruence, your ideal self matching your real self. How do you treat it? Person centered therapy, active listening, unconditional positive regard, empathy. All right, do this one. The answer is empathy. Can you see things from another person's point of view? Can you feel what they are feeling? All right, read that. The role of the therapist in person-centered psychotherapy. The answer is empathy. Look at that. Express warmth and empathy. Moving right along. All right, read that. Self-actualization. The answer is humanistic. Okay, read that. The answer is boom. You got to get your base level needs before you get your higher level needs. All right, that's enough for today. Thank you.